Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining Collegial Conversations with Diana Clark. Today, joining Diana is Dr. Robin Goodman. Dr. Goodman is a psychologist and art therapist with a specialty in trauma, medical illness, and grief. Currently, she is also Associate Director of Public Education and Bereavement for Child Help Partnership, St. John's University. Previously, she established child life and behavioral health programs at Pediatric Cancer Services at Mount Sinai and NYU Medical Center. She has held leadership positions at various organizations, including the National Child Traumatic Stress, New York State Psychological Association, Disaster Response Network, and American Art Therapy Association. I will hand the conversation over to you now.
Thank you, Alex. I appreciate that wonderful introduction. And Robin, not only do I want to thank you for this work that you do, that is so necessary, talking about the things that people run from, frankly. And thank you for being a guest on the show. I'm looking forward to talking with you.
Oh, my pleasure.
Excellent. So today we're going to be talking about grief. And where I would love to start, we've got a world in crisis right now. Everybody is grieving, I think, our country, their countries. What would be in this, what would be expected versus sort of problematic grief going forward in this situation? Yeah, or any.
Sure. Well, you want to also think about, sometimes we think about who's more at risk. And right now, of course, maybe everyone is because you're seeing things. But in general, in the world of grief, we also think about certain things that make people more at risk. And that is it a personal experience to you? Is it someone that you know specifically? Were you there when something happens? What's like the emotional connection to the person? Sometimes it's not that you saw them all the time, but that you were particularly connected to them. So, a child whose grandma may live in California and they live in Massachusetts, they don't see them all the time, but they talk to them all the time. They're really important in their life. So it's about the emotional connection as well as that physical connection and that proximity to what you're seeing visually, what you might be hearing specifically, and then also your personal characteristics and what happened, who you are as an individual can impact that. And it'll be some of that's the same for kids and for adults.
So there is a personality characteristic. We hear all the rubric about anger and all of these things about grieving, but I've always wondered, are there people whose personalities just allow them to move more easily through the grief process?
It's so interesting. I think we think of risk factors who might be more at risk. Certainly if you have a lot of other stresses in your life, there's other things going on, other traumas. With kids, we talk about other traumatic events. So the multiplying effect. So that makes a big difference, certainly. But one of the things I want to make sure I say is if people remember nothing else from today, it's that there are no stages. So when we talk about what's expected, there's no stages. For adults, we think about phases. Stages was developed by Kubler-Ross. Okay.
About the person dying, not about grieving, right?
Yes, not about the people left behind. And people they like things to be organized. I'll do this, then I'll do this, and I'm going to be all done.
I'll be angered, then I'll get denial, then I'll do this. Right.
Then what happens is like, oh my gosh, I didn't do this right. I'm having a hard time because I wasn't angry long enough, or like I never denied it. It's like, no. So we talk more about, for adults, about phases in terms of dealing with it, understanding your emotions, balancing the grieving and the living. There's a lot of models about this in terms of a dual process model or how you re-engage in your life. Some people talk about it, how you're on two different trains at the same time, the grief train and the living train. And sometimes one is going a little faster or further, and eventually the living one takes over as the grief becomes a part of you and you adapt to it. You find a way to keep that person in your life. Now, we also know there's a new diagnostic category for people whose grief is kind of getting derailed. It's not evolving to a kind of healthier place. They're not re-engaging in their life, in goals, in people. They're feeling still isolated. They can't adjust without that person. That longing is so great. And that's that's a very small slice of the grievers out there for adults. I want to make sure.
So when would you want to make, I mean, you certainly, if I lost my husband, you wouldn't say she's having a prolonged grief experience or disorder 6 months in. When would that start? That
There's some very specific kind of rules in terms of the diagnostic manual. And you wouldn't, really want to think, you want to think about how they're doing more like a year out into it. But at any point, I'll tell people, if you're having a hard time adjusting, there's plenty of things you can do on your own with a therapist to help you understand that. So it's not like, well, wait, it's not time yet.
Not time yet, right.
I suffered long enough. It's like, no, you can always go get help with if it's interfering, if you feel like you're not adjusting, if, you maybe feel like you're doing okay, but you're having trouble sleeping. So there's all sorts of reasons why you might still, without a diagnosis, get some help with managing and adjusting, figuring out how to deal with and access positive memories. And again, it varies tremendously if it was a traumatic death, if it was sudden, if it was some other circumstances. Now with kids, we could certainly use that diagnosis, but there's other things. With kids, we talk about something called childhood traumatic grief. And that particularly happens aside from maybe a prolonged grief disorder, but when kids are having a traumatic response, it may be because the death itself was traumatic for them. They may have witnessed it, or they were there when it happened, or it was sudden and it was unexpected. And then they may be having like a PTSD kind of reaction. And then after a couple of months, they really are having a hard time with being irritable and angry. But again, that's after a certain amount of time when you think, maybe they're not, not adjusting. Maybe it's interfering. And then there's some specific things you can do. But even for kids, we expect them to be sad and irritable and angry and maybe want to snuggle or sleep with you more, or maybe they've regressed a little bit. All of this we think about in terms of a normal, I don't like to say normal, but an
expected
trajectory. Yeah. And it's when it starts to not get better or all of a sudden gets worse. And that would be the same maybe for adults and kids, but we like to separate them out a little bit in terms of what we expect. No stages for them either.
No stages. That's good to know. That I love the idea that there are no stages, because I never resonated with them.
No, it evolves. Grief evolves. I've had adults say to me, like a parent who has a grieving a spouse or maybe even another child, and they say, if only I could stay in bed all day, pull the covers over my head and just, cry and be by myself for 2 weeks or whatever. It's like, but I can't because I have kids. Yeah. Good thing you got the kids, because in some ways it's like it engages them in living for their kids and while they're doing the other work, because that's the point. Grief evolves. It doesn't just stop and then start and then you're done. So it's learning how to manage with this, awful thing that's now a part of your life. It shouldn't be at some point the only part. I do want to, before I forget, I want to say one thing. I talked about kids and post-traumatic stress disorder, PTSD, and then everybody goes, no. Again, small sliver of kids that have that. And even so, because I've run groups for kids that have expected grief, and then I've done individual work with kids who are having a harder time, same thing for adults. We have this thing now called post-traumatic growth.
Love that.
And resilience. We talk about resilience, that's such a buzzword, but there's actually research on post-traumatic growth for kids and for adults. And that's where something awful happened, but you actually are doing something with that experience. Don't wish it on anyone, but if and when it happens, what else can you do? Learn to cope, learn what your strengths are, learn who you can connect with, find some meaning in this experience moving forward with your life. So it's not to paint a rosy Pollyanna picture, but
Right.
it's to think that, we do things with this that can be life affirming.
Absolutely. I heard a client say, we work in the addiction field and mental illness world where people are sometimes still in presence, but very, very lost to their loved ones. And I know that complicates grieving in some ways. Do you have some thoughts about that, where the individual is still there, but you have no access to them?
Yeah, there is some work, and not, recently, but certainly it becomes more important, is, what we call ambiguous loss.
Right.
And that happens sometimes too when it's an older person with Alzheimer's
Alzheimer's. Yeah.
or those other kinds of diseases that rob the person of who they were for you. And it's really, again, trying to adjust to this loss of who that person was, and figuring how you can adapt to kind of keeping some of those parts or figuring out what your new role is. Or, in the grief world, we talk about it, having a new relationship with the person. So that would be the same, whether in some ways it's ambiguous loss, like are they a part of me in terms of my memory, in terms of how I go about my life, how I use them, and who they were. And if the person is still alive, it may be, what is my physical relationship with them now in a new kind of a way. And it's a very different kind of loss. Then we have a third kind, really, that's somewhat related, and that's unconfirmed, which is also very difficult. With, you don't know what happened, and that can be for all sorts of reasons. Unfortunately, we see that with natural disasters, we see that in war, we see it with
Yeah. My
my
first experience with that was as a kid with missing in action people in Vietnam, and I remember their family members
yeah, and migrants have that. It's like, what about the people back home? And
behind.
people have various reactions and responses to that as well, in terms of guilt, or what do I, does it help me to think of them as still alive or not? And again, it's not a right or wrong, it's how are you managing it, sometimes.
Right. I had a client who lost a son to a fentanyl poisoning, and when I said to her, how do you feel like you will move through this? Because she was moving through it, and she said, and it was a really poignant comment that she made. She said, this will always be a hole in my heart. My job is to make the rest of my heart bigger so the hole seems smaller. And I thought, wow, that's beautiful.
Yeah, I mean, the thing about grief is that you don't see it on the outside.
Right.
And I tell people that, if you had a broken bone, you broke your leg. I use this analogy for lots of things. If you have a broken bone, people also want to, like, let's go get therapy right away. Let's, send my kid to therapy. I said, actually, you need to stabilize things first. And if you have a cast, you are not walking like you used to. And over time, you then maybe lose the cast, lose the crutches, and then you see how you're going. You get some physical therapy. And maybe you need extra because it didn't heal right. But there's a process here. So let's see what you need when. And I think the same sometimes happens with grief. And also, you can't see it, but you know what? If you had a broken heart, you could heal, but we would always see there's on an x-ray, just like in your leg, you would see where that break was.
Oh, scar.
You
Yeah.
would see that there's a scar there, but so you can honor that scar, but you can also heal it and figure out what you need to do to make it stronger. It doesn't mean that it disappears, and you know it.
Yeah.
And other people, it sometimes isn't invisible, but that's not invisible to you.
Right. So before we close, and I know that this was an amazingly quick interview, but tell me, what would you want our audience to walk away with other than there are no phases?
One is that, I guess all feelings are okay. Your grief is yours. Don't compare. Everybody is unique in terms of their situation and their feelings. And I heard a great comment yesterday at a conference I was at about grieving kids, actually. I don't know. I apologize because I don't know who to attribute it to. So whoever it is.
Okay, yeah, go ahead.
Pain shared is halved and joy shared is doubled.
Ooh, I love that. Sharing, talking about it.
And
Yeah.
it depends how you do that with one person, with a group, with a therapist. But it's like, you can do something with it. And if it's kids also, it changes over time for them. It's very different. But if you're the adult helping the child, it's okay to be honest and also model that all feelings are okay.
Okay.
They're all okay. And I also think sometimes it's about acknowledge what they are, and then you can act to help. But if you skip those, if you go straight to action,
let's just go have a good day without acknowledging that it's a tough day.
Because then it helps you realize, okay, this is happening and I can do something with it. And maybe it's to stay sad. Sometimes it's like, I'm just gonna be sad for a while. Sometimes like, yeah, this is what makes me better. So I think it's sometimes we also talk about, especially with adults, is have some self-compassion. So, be gentle and kind to yourself.
Gentle. Because I noticed when my dad died, I had some cognitive sort of oddities, things that I would have been able to track, like banking or things like that. I was losing grip on that. I was okay emotionally. I was okay in a lot of other realms, but I lost my brains for a little bit.
Yeah,
is that common?
Yeah, people don't give, I think sometimes I hear, some versions like, oh my God, I'm losing my mind. What's going on? It's like, you're grieving, or that was traumatic for you. And let me tell you what it's like when somebody goes through something traumatic, or when somebody experiences a death. You never went through this before, so why would you think that what your experience is normal? Just like if you broke your leg and you said, oh my gosh, I can't believe I can't walk. What's wrong with me? Well, you broke your leg. So, you have a broken heart. Your world changed in an instant. Everything about what you expected changed. Your view of the world changed. Your ability to now function because things have, I say, with kids, and again with adults, I sometimes say, imagine a snow globe.
Okay.
What happened is, imagine a snow globe, and now shake it up.
Okay.
Everything about your being has now just been shook up. And it takes time for it to settle down. And there will be things that will hit against that snow globe and kick things back up again. And you will learn what to do to be patient, or strategies to help calm it back down. And if you're an adult with a child, you become that protection to help them while they're doing it. And you need to figure out how you can manage it and whatever it takes for you to calm it down. But it's a process of settling, and it's going to be in new places. It doesn't go back to the same place.
Doesn't go back. Yeah.
But you can go forward.
You can go
Not back.
Yeah, I like that. Forward. I like that. Well, Robin Goodman, I appreciate you taking this time today.
This was a
wonderful conversation, and I look forward to having another one in the future.
My pleasure. Take care, everybody.
You too.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.